So I think National Health Center Week is so important for places like us here at Wheeler Clinic. The Health and Wellness Center is in the community. It's part of the community. We have so many things to offer. We have so many outreach workers that go out into the community. And I think with Access Health promoting it, one, people are going to be more aware of what services are available to these families. And again, from newborn, it's lifespan. We have geriatric care. So it's lifespan. So when they get connected, they're going to be able to stay here with their newborns and their adults and whatever else, and then they bring people in. We often hear from somebody, oh, so-and-so said, you know, they got really great care, so we're going to bring our family here. And then we get the teenagers and the newborns and everyone in the family and generational and really Hartford itself, that is the nature of this community, is multi-generational. So having Access Health promote it means that it promotes it for everyone across the board in all these families. And so that's why it's so exciting. So early intervention is the most important time for early childhood because the development of the brain happens during that time. So we find that the child's brain develops more so in the first 3 years of their life than any time over their lifespan. So when we can get a child in and promote medical, behavioral health, and all these other things at this time period, then we're going to promote healthy children. You need to take care of yourself to take care of your babies. And if you can take care of yourself by getting the care you need at the same time you come for your child's appointment, which they usually do, the majority of parents will show up for their child's appointment more so than they will for their own. So if we can connect those two, that helps the family be healthy overall, and that's what we're looking for. I think that parents tend to not seek out comprehensive care for children when they either have a history of having some delays in the family, and it's kind of scary to think, does my child have this as well? And I also think that sometimes it's a time thing, it's a money thing. So having a wellness center where they can come and get everything at the same time, they don't have to worry about transportation. They're coming here once and they can get behavioral health, pediatric care, dental. We can have all those things available to the children and for the adults at the same time. And so that really makes a big difference, where if they have to seek out multiple sites, multiple providers, it makes it so much harder for the family. So this, having everything in the same place, is critical. Parents are more likely to come with their newborns for all their newborn visits. And there's a lot of newborn visits. So we get to touch this family so many times by the time they're 3, that they really know us and we really know them. And it's really nice to be able to see a mom one day and have her be all excited to tell me, oh, I got a new job and you know, I need help with childcare. No problem, we can help you with that. We have resources. You know, I need transportation, I need insurance, I have a new baby and they're supposed to do it in the hospital, I don't have it yet, what do? We have people that do all those things here. So one of the new programs here at the Wellness Center is Healthy Steps, and I'm the Healthy Steps specialist. And what I get to do is I get to watch these babies from their first visit to the clinic with the pediatrician, and they stay here all the way until they're an adult. And when they're an adult, they're going to transition to the adult units. So I get to watch these new moms, these new families developing, these babies, and then the babies coming in with their younger siblings. We get to see the whole family unit. And so being able to see the wraparound services we have for these families, whether it's through, you know, we have emergency services too. So we have EMPS, we have ICAPS, we have MDT, we have all these services. And the thing that's really exciting is we work together. It's truly integrated so that we see all the providers once a week. I just came from it. Once a week, we meet as a multidisciplinary team to discuss any complicated cases we have so that everybody can help each other. And so we're all invested in these families. Wheeler Clinic's Health and Wellness Center is a very exciting place to bring families into, to have them be able to get all the services they need under one roof. So each floor is dedicated to different needs of the family, and so we can address those for all of them. And having it in one place, again, makes it so much easier for them for transportation. Their information is in the system. They don't have to always go looking for their insurance stuff. If they don't have insurance, we can help them to get it. There's people here that can do all those things. So we have adult services through behavioral health, medically assisted treatment, adult medical care, and then through the children, we have outpatient, children's outpatient, pediatric, dental. We have community health workers that work with all the families, whether they're in adult care or children's care. So we have people who can help them with basic needs, finding resources in the community. We have MAs, we have therapists, we have everything right here. We also have a chiropractor and meditation and Zumba, and so there's just so many resources available right in this building